Now I'd like to invite Teresa Younger from the Permanent Commission on Status of Women to come.
Yeah, whoever knew. You know what this upholding, the Supreme Court's upholding this decision has done is it has really leveled the playing field for women. We know that women are paid less than men, and yet we have gender rating, which requires that it allows health insurance companies to charge women more than men just for being a woman, just for being born a woman. That kind of disparity over a lifetime is significant for women. It also took a look at the fact that women are making lots of healthcare decisions within their families. And so it looked at pre-existing conditions. It looked at preventative healthcare measures. It looked at the true costs affiliated and associated with reproductive healthcare and over a woman's lifetime. And it was critically important that this decision be upheld for what it allows women to do, the savings they will be able to commit to their families, and the ability for them to make decisions for themselves. We know that the greatest number of medical bankruptcies go towards women because they cannot afford the cost of health care. And they are the ones oftentimes making the decisions for their families and themselves, and they will oftentimes put themselves last. And through the upholding of this piece of legislation, we can see that women won't have to put themselves last any longer when it comes to caring for themselves, making educated and informed decisions about their bodies, and educated and informed decisions about what's going to happen next. You know, Christine, you asked the question about, you know, what will people think? I think the passage of the Supreme Court's upholding this decision, what it actually allows us to do is have a very real conversation about what the Affordable Health Care Act does for women and their families, for communities, and for the country and the state. It allows us to have a real conversation, not hyped up in fear. It allows us to really say to people, if you have the facts, you can make the decisions, and guess what? You can't get turned away at the door. You don't have to give up those decisions. And you know, we've worked in conjunction here with the Universal Healthcare Foundation and many women's organizations to ensure that people have an understanding, including Planned Parenthood, which is why I've asked Judy Tabar from Planned Parenthood of Southern New England up here, because she really understands the concepts and around the conversation, the ongoing conversation around preventative health care measures and what that looks like. Judy?
As a provider to 70,000 patients in Connecticut and Rhode Island, we have experienced firsthand what it means for women to need affordable health care. And 80% of our patients have low incomes. So for them now, they won't have to make a decision about whether to buy their birth control or pay for their groceries or fill their tank with gas. They'll be able to get their preventive health care and birth control, cancer screenings without a copay. And this is the greatest advancement for women in a generation.